Hi everyone, I'm Audrey Dion from Cardiology at Boston Children's Hospital, and today we'll talk to you about primary treatment intensification in patients with coronary aneurysm at time of diagnosis of Kawasaki disease. While the use of IVIG in Kawasaki disease has significantly reduced the risk of coronary complication, there remains a small subset of patients who will develop coronary aneurysm. Adjunctive therapy beyond IVIG has thus been sought to further decrease the risk of coronary aneurysm. In the absence of evidence base, centers have varied widely in their use of corticosteroids, infliximab, or other adjunctive therapy for the treatment of patients at high risk of Kawasaki disease or those with resistance to initial treatment. So in Japan, clinical risk scores have been established to identify patients at high risk of coronary artery complication. However, studies in North American population show that it lacked both sensitivity and specificity to identify patients at higher risk. However, coronary artery Z-score on echocardiogram at time of initial diagnosis has been shown to be predictive of future coronary outcome, thus providing us a mean to identify patients at risk of adverse coronary outcome. So of the 121 children meeting inclusion criteria, 30 received corticosteroids and IVIG. 58 patients received infliximab and IVIG, while 33 received IVIG only. There was no significant difference in coronary artery Z-score at time of diagnosis. Primary treatment intensification with either corticosteroids or infliximab were independent protective factors against progression of coronary aneurysm size on follow-up. However, there was no significant difference in maximum coronary artery Z-score or in coronary aneurysm regression rate. These findings suggest that primary adjunctive treatment with either corticosteroids or infliximab may be protective in patients with coronary artery aneurysm at time of diagnosis. While this study suggests that primary adjunctive therapy with either infliximab or corticosteroids may be beneficial in patients with aneurysm at time of diagnosis, adequately powered prospective randomized trials are needed to determine the best adjunctive therapy in patients with Kawasaki disease and coronary artery aneurysm at time of diagnosis. Trials should not only compare adjunctive therapy to IVIG alone, but should also compare the different therapies available.